Welcome to the Explore Global Health podcast. I'm Dr. Rob Murphy, Executive Director of the Havey Institute for Global Health here at Northwestern University Feinberg School of Medicine.
Today we are talking about an exciting collaboration between Northwestern University and Stellenbosch University, located in the Western Cape of South Africa, specifically in Stellenbosch, the city, and Tygerberg, which is closer to Cape Town, where the medical center is. This collaboration promises to foster an international, bidirectional partnership that we think is essential to help solve complex challenges in global health. Dr. Hester Klopper from Stellenbosch University joins me to talk about Stellenbosch University and Northwestern University Global Health Knowledge Hub, this new collaboration, which we just recently launched after many years of partnership between our two universities. Hester is the Deputy Vice Chancellor of Strategy, Global and Corporate Affairs at Stellenbosch, and she is also passionate about global health, with a research interest in the role nurses play in policy influence and strengthening health systems. I welcome her today to talk about the evolution of this partnership between our universities, the vision for the hub, and the impact we hope it will have on both local and global communities. Welcome.
Oh, thanks so much, Rob, and thanks for having me.
Before we dive into the details of this new partnership, let's hear more about you. You started your career in nursing and midwifery. Tell me about your path from nursing to become a huge academic global leader in higher education.
Well, Rob, I started off studying nursing science, and in South Africa, it's an integrated program that leads to a professional qualification in both nursing science and midwifery. And that followed with postgraduate studies in community health, nursing, and also psychiatric nursing. Today, we will talk about mental health. And that has really been one of the other clinical areas that has always been one of my interest. And following the postgrad studies, I then did a master's and a PhD in health science education. And I was still a very young academic. I was fortunate to complete my PhD at the age of 30, so it goes back many years. And I think that provided me with the opportunity to then embark on an academic career. And as I engaged more, especially in health science education in the interdisciplinary space, working across different professions, that really became a focus of my work. First within the education, interprofessional education space, but then later into more health systems, which was really grounded around looking at how do we create positive work environments for healthcare professionals. And that, of course, led to another development in my career, starting to focus on leadership development and capacity development of scientists. So it's really within that space that I've been working, let me say, transdisciplinary, interdisciplinary space, both in education and in leadership and health systems.
And where did you actually do your training?
I completed my master's and PhD ultimately at the University of Johannesburg. At that point in time, it was still called Rand-Afrikaans University. And then later, I did an MBA in the UK.
You have a strong interest in global health. How has that evolved throughout your career?
Well, if one engages in the work that we do, especially on the continent of Africa and the development work, and here, if I say development work, it's about the development of healthcare professionals. I became aware of really, once one dive into global health, it is around the social determinants of health, how that plays out is, really speaks about the improvement of how do we speak to health equity. So I became intensely aware of those challenges on our continent as I engaged actually in capacity development, and that capacity development working in different countries on the continent in developing health science education at a master's degree, where I became aware of the space of global health. And of course, what we see lately is really, it's changed so much given the challenges that we have that continues in terms of health equity challenges, access to healthcare. But then ultimately, I think the coronavirus, experiencing that across the globe. But on the continent, and especially in South Africa, we've really been tackling the infectious diseases over many, many years, like HIV/AIDS and TB and malaria, and then lately now the emerging threats that we've seen like with COVID. The other part that ties in for me in terms of global health is the non-communicable diseases. One should not ignore that on the continent. We see the rise in terms of the cancer statistics, cardiovascular disease, etc. One part most probably that I would like to highlight through my work that I've done at one of the very large nursing organizations, which is Sigma International. We ran a program for maternal and child health, and that was the other part that really tied our work into the global health. The moment one starts talking about maternal and child health, then you start talking about how the accessibility within health systems and how do we strengthen health systems and the capacity development around that. And then, of course, lately, climate change, human rights, social justice. You know,
Exactly.
Global health is just such a dynamic space where all of these elements comes together.
Stellenbosch University's Faculty of Medicine and Health Sciences is known as one of the leading medical schools in Africa. I believe it's one of the top 3 schools on the continent.
Exactly, yeah.
Give our listeners an idea of the research and education taking place there now.
Well, our Faculty of Medicine and Health Sciences is, as you hear, medicine on the one side, medical training, but then also looking at the training of nurses, of midwives, of physiotherapists, and all the other, what we would refer to the allied health professions. So a broad base. But our university is really known for cutting-edge research, and that speaks to, for example, around cancer. There's the Africa Center for Cancer Treatment based at the Tygerberg campus. And most recently is the launch that we had about 2 years ago of our Biomedical Research Institute, world-class facility that really provides the opportunity for scientists now to do the genetic profiling. And that's exactly the work that they led during COVID. A team of our scientists, they're leading work in some of the other identification of some of the genetics of pathogens, specifically on our continent, and building capacity, building programs of scientists that does that work across the continent. Orthopedics, strong focus. It's really almost any area that you speak in medicine and health science, we've got those experts. Most probably something that may be unique, I think, is our focus on rural health. We've got a very large capacity at Tygerberg itself, but then also a campus, which is our Worcester campus, focusing on rural health. And I think that's a very unique dimension that you don't often find linked to medicine and health sciences faculties. Typically, the work that we do is also engaging primary health care. So you would also find a very strong focus around family medicine and the training of specialists in family medicine.
Well, I can certainly vouch for the scientific achievements at Stellenbosch University, which is one of the reasons that Northwestern was so happy to get more engaged together with Stellenbosch University. I mean, I believe it was your scientists there that uncovered the Omicron variant and some of the other variants that emerged during COVID.
That's exactly it. Professor Tulio de Oliveira and the team, they did that leading work, and that's the work that they continue now.
Yeah, it's very impressive and has really elevated the stature of Stellenbosch University worldwide. How critical are international partnerships with Stellenbosch and other universities around the world? Maybe you could tell us how many you have. I know a lot of schools want to work with you, and we are very happy and proud that we can develop our relationship even further. But we understand we all work with multiple institutions. How big is your international portfolio?
Internationalization at Stellenbosch was celebrated in 2023. 30 years of internationalization. So at Stellenbosch University was the first international office established. So there's a long history. However, over the past around 8 to 10 years, we have deliberately developed an international strategy that brings together what we call a comprehensive portfolio. And what that implies is really looking at working with partners where we can build not as many partners, bilaterals, but rather deepening that relationships. And those relationships is around both offering of programs, it's research, it's student exchanges, staff exchanges, co-funding. So it's really the full portfolio around internationalization. So if I say that, And you ask me the questions, how important is it for Stellenbosch? It has been one of our key strategic focus areas over the past 10 years. And the intent for us is really about building our academic quality, because you know that the more we work with people and diverse scientists and research around the world, the better the outputs. It also provides us with the opportunity to expose our students into those environments. And that has really led us to develop quite a number of joint doctoral degrees. We've now, around with our key partners from around the world, we've had more than 60 of those that we are running. Our intent is to really grow that area. But I think it speaks then to building that global accreditation, building the global reputation of an institution. And it's not just around the institution's name. For me, it's ultimately about the quality of the qualification a student gets. I mean, the better your reputation, the more value is to your degree. Linked to our partnerships is really the promotion of research and innovation and providing collaborative research opportunities for both our staff and students. And the spin-off of that has been through these collaborations, through the joint programs, that has led to increased funding opportunities, where these teams will have joint funding applications, and it's opened doors for us in terms of those collaborations. The other part that has been very supportive in the work that we do and that we see as it's really been a benefit for Stellenbosch University, you start sharing infrastructure. You know, it's where, for example, postdocs can do work in different laboratories, and they get that exposure. And also lately, I mean, with having access to data from around the world and working in different spaces, it really supports that development of our students.
Educational exchange programs and research collaborations have been part of the history between our two universities for over 2 decades. We have hosted bidirectional exchange of medical students, with students spending 4 to 8 weeks living in Stellenbosch and Chicago. Your students rotate at Northwestern Memorial Hospital and ours at Tygerberg Hospital in areas such as infectious diseases, primary care, pediatric surgery, and more. How would you describe the success of this exchange program?
The success of this program has really been critical in driving our international agenda because it provides, and the success is the opportunity it provides to access of a different experience and a global experience. So through this exchange programs and the collaboration, I would want to coin it as the opportunity to build global citizenship. I think has really been the success of this program, because the interactions with international peers really prepares both our younger staff but also students to thrive in this multicultural and interconnected world. And I see that as the essence of success of our program.
We're now entering a new phase of this relationship and our continued growth in our bidirectional partnership with the SUNU Global Health Knowledge Hub, which is designed to promote innovation in global health through collaborative activities in the areas of education, research, and community engagement. What excites you about this hub and its efforts?
Well, and to be honest, I'm really excited about this new development. Since we started talking about it. So why am I excited? I'm excited because I think it provides us the opportunity to collectively look at how we address some global challenges, all those challenges that we referred to earlier around global health. It's an opportune time facing issues around global health, but looking at the interconnectedness between energy challenges, water challenges, infectious diseases, universal access to healthcare. All of that, it brings it together within this hub. And the other part that excites me is that, and specifically from our university's perspective, is the opportunity for our faculties, not just one department or one faculty, but departments and faculties getting together in this space where it's really about interdisciplinary exchanges and working together, addressing these major challenges.
Believe me, I'm as excited as you are, and it's been such a pleasure working with you over these years together to pull this off, and we're very excited too. So there's many opportunities for faculty and trainees that may be considering a career in global health in particular. And we have developed a series of working groups between our schools to further the continuation of global health research and collaboration between the institutions, including global primary care, like you mentioned, biomedical engineering, which is probably our longest running program at Stellenbosch. The Infectious Diseases and Genomics Working Group, Health Profession Education. And our new one, Climate, Health, and Environmental Engineering. We expect that grants will be open to both Northwestern and Stellenbosch faculty, sharing resources and faculty expertise while furthering pivotal study as well. Let's briefly talk about these working groups.
How we've structured it is that there will be a lead from Northwestern University and a lead from Stellenbosch University. And these colleagues have already started meeting. And how we, between us, hope to really get this going is, as you said, to make sure that we provide the seed funding, and we believe that will really be dedicated catalyzers. We would give some awards in terms of the project, and as work progress, we will build in other award systems to support our researchers to do this collaborative work and ultimately to build their teams on both sides, engage, and then to really go for some large international funding. And I think that really is just such an ideal opportunity to grow global health, our partnership, the interdisciplinary space, and of course to provide students of the future opportunities to embark on career opportunities within the global health space.
And we provide these what we call catalyzer grants, $25,000 for a one-year project, just to get people together. People like Bob Mash at Stellenbosch and Lisa Hirschhorn at Northwestern, Matt Glucksberg in engineering here, and Christian Schrev at Stellenbosch, Ashti Dubé-Prasad at Northwestern, and Susan Van Schalwick from the Health Professional Education component, and the Infectious Diseases and Genomics Working Group, which includes Tullio Diola from Stellenbosch University, Frank Tanzer, also from Stellenbosch, Claudia Hawkins, and Egon Ozer from Northwestern. And our newest and really exciting Climate, Health, and Environmental Engineering Group, led by Professor Christina Trois and Kim Gray at Northwestern. So these are really great things to go. We're happy to give this starter money, but we have a second level of that, and it's called our Global Innovation Challenge Awards, and those are up to $250,000 for projects up to 2 years. I really look forward to getting this thing off the ground in a really big way using the infrastructure that we have, and I'm so happy to be able to have the collaboration of your faculty.
I must say we really need to thank Northwestern University and the Global Health Institute for the support that you've given to Stellenbosch University in this partnership. I honestly believe this is going to be a game changer, and I think it also ties into some of the plans we have for next year, where we will be bringing together these thematic groups. We will have a launch and a joint conference that is scheduled for 17 and 18 March. Next year, we will have the thematic groups. They will be presenting some of their initial work, and then also to invite broader possible members from different areas actually come and listen and see if they want to join some of these projects. So it is really this official hub that we're putting in place. It's a physical space, collaboration between our Faculty of Medicine and Health Science and Faculty of Engineering, with some interlinks with other faculties. Launching the hub will take place next year in March, and I believe this day will take off. And will grow.
And maybe you could comment on two of those programs, two of the new ones. One is the Stellenbosch University Public Health in Africa Study Abroad program, and the other one is the Biomedical Engineering in Africa Study Abroad program.
The intent to take these two programs and expand it and open it up. So this is not a collaboration focusing only on Stellenbosch University, but it's using Stellenbosch and Northwestern collaboration to unlock opportunities also for partners across the continent, and pulling partners and collaborators from across the region first and then later at other East and West African universities. And the intent is really to build capacity of young scientists and to provide them with opportunities to first link into research groups, but then also to build capacity in their universities. And that's really what we need, is this capacity for science. That's a large focus and intent of these groups. And my take would be, although these two are starting off, my take would be that the others will also do similar work in reaching out to partners across the continent and really building this hub of knowledge that we can share across different parts of the African continent.
One very special aspect of this new hub are the physical spaces on both the Stellenbosch campus and the Tiger Heidelberg campus, which is the medical campus. And you have committed in a very big way, dedicated space for this hub to work on both of those campuses. Why is this so important?
You know, most probably this goes back a couple of years when I started really working in the international space. I once met with he was at that point in time, he was a CEO of a very large international company based here in South Africa, but they were spreading their wings onto the continent. And I had a discussion with him to understand if universities want to expand on the continent, what is the one piece of advice that he would give me? His reply was that make sure that you are visible, that your brand is there, and even if it's in a 3 by 3 meter space, if somebody walks in Nairobi, they want to know that is the little office that belongs to that brand. And that lesson for me was, and I've seen it over many years, is that the moment there is a space that people see the brand, that they see the collaboration, it becomes real. And this is really the intent for us. So it is a place that both Stellenbosch and Northwestern University students can call their own in this hub, where they can collaborate, where they can do their work, where they can engage in groups. But it's also open. It's not exclusively for only those involved in these programs and working groups. We open it up for other Stellenbosch University students. And come and see what's happening there. So it's a creative space where there's engagement with science, sharing of information. But I think the other part that is, especially in the biomedical engineering group, where they embark on the development of devices that can support work in primary health care. I mean, that's so unique. It's addressing an issue that we have here in country. It's critical to health care. So it's addressing real-time, real-life issues. And I think that's the uniqueness of this. So committing space, committing infrastructure really shows our commitment of moving forward with this partnership.
Our inaugural conference is March 17th and 18th. We have a nice group coming over to get the thing off the ground, and we have our annual meeting of our big biomedical engineering grant at the same time. We have multiple things going on. I can't wait. Now, I understand your career is pivoting in the very near future, and you have taken a position as Vice Chancellor at another university in South Africa. This is a huge promotion, and congratulations to you. But I want you to tell us about it.
Oh, thanks, Rob. One thinks of what opportunities exist to really make a contribution in country. Honestly, given the reality of our country, poverty, the lack of jobs, even, our graduates that are without jobs, one can use universities to unlock the potential for the future. In that process of making that contribution, it's been on my mind to see, okay, so what next? And an opportunity presented itself. I've been successful and has been appointed as the 15th Vice Chancellor and Principal of the University of Free State. This is a university in the central part of South Africa, in Bloemfontein. So I'm very excited to join the university. It is a university with around 40,000 students, 3 campuses, also have a large medical faculty. It's a very, very long-standing history. University is 120 years in existence this year.
It sounds so exciting, and I'm so happy for you, and congratulations. I mean, Vice Chancellor that's the highest position in a university in many parts of the world. So congratulations to you. And I have just one final question for you. What advice do you have for a young person in the medical field who is just now embarking or wanting to embark on a career in global health?
Well, I would first say actually look at all opportunities, because there's not just one path to work in global health. Find a path for yourself. The second is really go and seek for opportunities. There are so many opportunities to get yourself linked into the global health space. And this could be through ensuring food security. It could be water. It could be climate change. It could be the health component. But it's about thinking, how can we impact United Nations Sustainable Development Goals through global health? It's all of these different areas and spaces that can bring us and link us into global health. Use the opportunities that exist. If a door opens, use it. My last point would be, don't be scared to reach out, even if it's a professor that you think is in a high position. If you reach out to them, they would be more than willing to share their work, to speak to you, to give advice. Go and seek for it. And ask them, take me with, show me how to do it. And you will find those professors that will mentor you.
That's great advice, Hester. Well, thank you so much again. Congratulations on your new position. I look forward to seeing you in March at our inauguration of the Hub and seeing that grow and developing a new relationship at your new university. Thank you very much.
Thanks so much, Rob.
Follow us on Apple Podcasts or wherever you listen to podcasts to hear the latest episodes, and join our community that is dedicated to making a lasting positive impact on global health.